going to see an orthopedic spine or a neurospine surgeon or team, you always want to make sure to bring in the Maxi, the V2 broken and stripped, and our new S9 spine system. I'm going to go over kind of the reasons why, also how to present those to the teams so that you're more impactful and get the sale faster, and talk about the capability that these three systems combined bring to these teams that are out there. So the Maxi is kind of a new addition to the spine call point. I have recently learned from one of you guys out there why the Maxi is valuable. So what we're going to do here is we're going to look at your typical spine constructs. So you've got a pedicle screw going down in, a saddle, a rod, and then a cap. So the problem with a lot of the setup in doing surgery is that they'll have tissue, and this tissue doesn't allow them to get a solid driver of any sort into the cap. So if they've got tissue right here, they can't get in on that cap to get that cap screw out. So why is the Maxi set so valuable? Well, we have all of these drivers duplicated into a flexible shaft that will then allow that surgeon to get around that tissue and into the cap itself. So if you're not bringing in the Maxi and showing to the spine, ortho, or neuro guys that they can get in and around some of those direct conflicts that they have with our flexible shaft, you're kind of costing yourself a little money and you're reducing their capability. Again, when you're showing the Maxi, talk about the square handle, talk about the ratcheting, talk about how universal the system is as a whole, and then really focus in on those areas where they can't get a solid driver directly into the pedicle or on the cap itself because of tissue impedance. So it's really valuable to have the Maxi. Moving on is obviously our most popular set ever, the V2 broken and stripped. The thing about spine surgery is you're looking at very little bone to work with in a very delicate area of the body. So they're never going to go in here with a Synthes type coring reamer that takes out the entire bone length of the construct. It's never going to happen. So when a surgeon has a broken or a stripped pedicle screw that they cannot remove, what they'll do is they'll actually just skip a level. So a 2-level fusion now turns into a 3-level fusion. So that's, really not a good outcome for the patient. The surgeon certainly doesn't feel good about it. When he could simply use our broken or stripped extractors to remove this construct, one of the things that if you do not have on your phone that you should be showing is this x-ray right here. This is a x-ray of our broken extractor going down in a minimally invasive spine set or case and removing a broken pedicle screw. This is an amazing video or x-ray. If you're not using this x-ray, every time you talk to a spine doc when you're showing this set, get this from me and pull your phone out of the pocket and make sure you're using this. So the capability here that we provide for these surgeons, because they will run into broken or stripped pedicle screws, we are the answer. Then we move on to an incredible system that we recently launched this year is our new S9 spine set. You have 56 cervical drivers, you have 76 thoracic and lumbar drivers for a total of 132 drivers. As a backup, you have the helicopter system built in, which I'll illustrate for you, but we're just going to kind of discuss what happens in spine surgery. So in spine surgery, they open the patient, you have a construct that looks like this. What their first order of business is removing the cap so that they can remove all the caps, remove the rod, then go down in for the pedicle screw. So you have a pedicle screw with a saddle. So once they remove the cap, they remove the rod. You have the pedicle screw that you have to go down in. They take that out, everything's clean, and then they put it in there. The problem with spine is there's so many manufacturers out there that when they're doing a revision, many times they don't have the appropriate equipment that they need. The Medtronic is probably our biggest competitor, and it sells for probably around $60,000 just for their spine system, which is probably 40% less capable than what we're providing. The problem with that also is for the Maxi, the V2 broken and stripped, and our spine system, it totals up to $55,000. So for 60 grand, they can have the Medtronic Evolution set, Or for 55 grand, they can have the most capability they've ever had in spine revision surgery. So again, they're gonna remove the cap, remove the rod, go in for the pedicle screw, and all of these are different configurations. So a lot of people are scared to sell spine because they don't really understand spine, and it is a big surgery, but you're basically just looking at tooling. It's basically a maxi set on steroids because there's so many design configurations for spine. So don't be intimidated when talking to spine surgeons. Feel free to say, I don't know, I'll find out, but show them. Once you show them, they love it. The other thing that's great about this, for an extra $5,000, they can get an additional instrument tray and run a cervical room and a thoracic lumbar room. So for 40 grand, they can have 2 rooms running and really extend that capability. So let's talk a little bit about what the helicopter set brings to the backup plan for a spine surgeon. Sometimes they can't get this cap off, or they get the cap off, but they can't get the pedicle screw out. So what do? Well, they can cut the rod 3 millimeters on both sides and then come over with our helicopter socket. So we call it the bailout. So now they helicopter the entire construct in reverse out of the body. So they don't have to leave this in and just work around it. They can actually helicopter kind of worst case scenario and remove this construct out of the body by just simply cutting the rod on each side, and we'll have a rod cutter coming out. So if they ask, do you have a rod cutter? There is one coming. It's in development, but they can put the cap back on, come over with the helicopter socket, and in reverse, just helicopter that whole construct out. So it gives them the bailout. So again, these 3 presented together brings a capability that is incredible to your spine teams. I really think that this is the most underutilized grouping of products that we have, because many of you have fear of spine, but don't have fear of spine. Simply bring these in, present them like I've taught you in this video. If they have questions for you that you can't answer, simply say, I don't know, but you're really passing up probably the easiest $55,000 sale you've ever had in your career simply by getting these 3 sets. Any questions, call us. That went pretty smooth. I think that went pretty smooth. I had a couple of little
No, it was perfect.
wordings.
Keeping that part in.
Yeah.